All right, good morning, folks. This is Coffee with Community Services. This is March 29th, 2024. My name is John Decker, the Director of Community Services at Alta California Regional Center, welcoming you to our weekly service provider meeting. As per usual, we'll go over some introductions and then we'll do our agenda and go from there. So for today, I see we have from our Community Services Department, I see Melinda is on here. Good morning, and Jaslyn as well. And my assistant Zach is on, and Christine is on, and our client services manager Cindy Lay is on. Good morning, Cindy. And I see Shauna and Tom and Dee Dee from Community Services, and Marty as well, and our lead community services specialist Heather. And I suppose we can welcome Courtney Cornelison. Courtney, do you want to unmute yourself and say hi real quickly to everyone?
Hi, my name is Courtney. I'm new to CSS. I was with Ulta in residential for a few years, went over to CPS, had a lot of experiences, and now I'm back and I'm happy to be here. So thank you.
Well, welcome back. And being a CPS alumni myself, I can tell you that it is quite an experience working there. So we're happy to have you and bringing back all of your residential experience, your county experience. I think is really going to help out our department. And you're going to be working under Jordan's unit. So, all right. And then we have Michelle Duchesne here as well. Good morning, Michelle, our client services, excuse me, community services manager. And Jessica is on this morning. Good morning, Jessica from CSS, and Beverly and Carly and Gary, and our lead community services specialist Jason is on. And our deaf and hard of hearing specialist Michael is on this morning as well. So Michael is here. Good morning. And we have newly returned client services manager Toby Golden. Toby, maybe I can have you say hi to some folks real quick. What's your job at Alta?
Good morning. My job now at Ulta is the manager of the intensive case management unit. So I do all the 1 to 25s, 1 to 25s, 340, 1 to 45s. We have the PDC liaison, the conservatorship caseload, and a facility liaison. And I'm probably missing something, but a little of everything over here.
Awesome. And we're happy to have Toby back. Toby was working with one of our service providers. And before that, Toby, you were with us for how many years? And you had two different jobs with us too.
Yes, I was here for 10 years prior to when I left. So I was children's service coordinator for the first three, and then the latter seven as a client services manager in one of our adult units.
Awesome. Thank you so much, Toby. And Toby's been in the field for quite some time. Rhonda Phillips, our housing specialist, was reminiscing to Toby's days at Easter Seals long, long ago. And so, anyways, good to see you, Toby. Elijah, hello. Good to see you taking a break from all those vendorizations that you're doing. Good morning. And Rhonda is on, our housing specialist. Good morning. Let's see. We've got client services manager Dana on. Hey, Dana, your job's changing a little bit. Are you cool updating folks with kind of what's going on with you?
Yes, I am now client services manager in our enhanced services coordination unit. And we actually are covering the 1 to 40 clients, serving language and ethnic needs in Hmong, Punjabi, Russian, Spanish, and African American.
Awesome. Thank you so much, Dana. And this will be a new, exciting challenge as we, embark on specializing even more of our services. So awesome to have you take on this role. Client services man, or excuse me, community services manager Helen is on this morning. Good morning, Helen, as well. We got Rihanna from QA. Good morning. Our QA manager Scott is on too. Adriana from CSS. Good morning, Adriana, as well. I see. Who do we also we got here? We got Camilla, our director of intake and clinical services. Got Christina, client services manager, on as well from residential, and Leah on from CSS, and Kylie from our one of our HCBS specialists taking a brief break from going door to door doing evaluations. Client services manager Wyatt is on here, and we've got Jaslyn as well. Good morning. Hey, Kat, I see you on here too, and I know that you're not necessarily too shy about talking to groups of people. So, can you share real quickly what a PCS does and who you are? Are you cool with that?
Yeah, sure, of course. So this is we're assigned.
Oh, your sound is horrible, Kat. We can't hear you.
Can you hear me now?
Perfectly. Excellent.
Okay, awesome. Okay, so a PCS is assigned to units, and whenever somebody in that unit has interest in SDP, the client, I mean, they tell their service coordinator is going to notify me, and we're going to be paired to support them. I'm going to educate them on how to fill out all of those forms that are involved, how to do the unmet needs, meaning to figure out what needs to go on the budgets, how to review spending plans, things like that. I'll also be there to review every spending plan, to make sure that all of the purchases are in line. But the big thing there is just education for the service coordinators and then also education for the community. I go to community outreaches just to share with the community what self-determination is, because it is a great program and the whole community should know and get involved. And yeah.
Perfect. Our self-determination program we heard at our board meeting has just grown so much. The numbers were presented, and I will say, with I think a lot of the work that is being done by our service coordinators and the managers, and certainly the PCSs and the service providers that are willing to do self-determination services, our regional center has really excelled in getting those numbers up there. And I just want to say I appreciate having kind of experts like yourself that can really provide support to service coordinators, in this area. And appreciate you letting me put you on the spot. So thank you very much. All
Thank
right.
you.
For our agenda, I think Melinda's going to be up first, with the Deaf Culture 101 and also our sign of the week. And then we are going to talk about some of the upcoming things we have going on. We've got the Sac City Council coming up for one of our housing projects. We have DSP stipend updates. Carly's going to give an update on the employment directive that came out related to the coordinated career pathways. Let's see, we have an update on HCBS numbers from Scott. We already introduced Courtney, so there we go. We got that off our agenda already. And we have the RFP information related to the out-of-home respite and outpatient substance use treatment. We'll discuss that. I don't know if Eric Champa's on today, but if he is, maybe he and I both can give an update on the transportation work group that we participated in. We told you that the state of California is working on finalizing what the rate study is going to look like. Myself and Eric had an opportunity to participate in the first work group, and I don't know if he updated folks last week during this meeting about it, but we definitely got a little bit better of a picture about what they're going to be doing. Let's see, we are going to talk about also our upcoming event calendar, and then some of the upcoming events. UCP has an event on April 5th that I want to share the flyer for in the evening. So we'll get into some of those different things, as well as where I've been at town hall meetings and presentations and stuff if I've got time. So I'm going to throw it over to Melinda now and trust our interpreters are going to set up our screens as best as we possibly can.
Okay, can you hear me now? Okay, so thank you, interpreter, and thank you for the voice I heard in the back saying, hey, I'm on mute. So I just remind everyone, I'm going to voice for myself. Yeah, so today for Deaf Culture and ASL 101, we are going to learn how to introduce ourselves, okay? So the last time you met with me, we discussed how to we were learning the ABCs, we were spelling all the basics, we were learning how to recognize letters in sign language. And so now it's important for us to learn how we will introduce ourselves. When you introduce yourself in sign language, you're typically going to give a greeting like hello or good afternoon. And then you're going to say my, which is a flat hand, number 5 on your chest. My name is the letter H, dominant hand on top, 2 times tap, name. And then you're going to finger spell your name. So for an example, my name, Melinda. So I want you to try it yourself. And I'm going to see everyone trying it themselves. So again, you tap on your flat hand on the chest, my, double H's, tap, name, and then you spell it out. And the next time we meet, I'll ask you how to ask for someone. But that's where we're going to leave it today. And the next thing that was given to you guys in email is about famous deaf women. And there's a lot of them internationally, and I included one of them. But we are going to discuss, or you're going to meet through the PowerPoint, 17 to 18 of them. And I'll quickly go down the list for you. We have Marlee Matlin, Claudia Gordon, Juliet Gordon-Lowe, Gertrude Elderly, Helen Keller, Linda Bowe, who, if you don't know her, she's from Sesame Street, Annie Jump Cannon, Evelyn Glennie, Regina Olsen Hughes, Helen Germa, and she's famous because she's deaf-blind, and she's a huge advocate in the deaf community and the blind community for equal access, and she's also an author. Michelle Banks, Heather Whitestone, Ida Wanette Gray Hampton, Cornelia Lathrop, Lauren Rudolph, and Ruth Benedict. I put an effort, or made an effort, to include as much diversity as I could. And you'll see that a couple of these folks are actually out of the country. They're from England or from Europe. And one of them is a famous drummer who has traveled around the world. And it's pretty interesting. I learned a lot doing this research for you. I've knew these names before, but I didn't really give much information. So in the past, and I figured I'd do even more in-depth information this time. Most of them are videos, about 1 minute to 5 minutes long. There's a couple that are much longer than that because that's the only resource I could find. And really, I want you guys to learn, and please give feedback on the survey. So every week we've been pushing this survey, and I'll put it here in the chat here in a moment. It's important because this survey gives me and Michael feedback. We need to know what you want to learn about. And I have 10 people out of all 87 to 100 of us. And if I calculate all the meetings we've had, we've met, more than 100 people, basically, or individuals. And I only have 10. So I would please like to have more feedback from you, as just so I can figure out, and Michael can figure out how to guide this presentation and to take it where we want to take it. And to give a little bit of insight, in the next couple of months, we are going to have a sign language chat. So about May or so, there's been a request to learn more ASL and to learn more communication. And so we are going to divide and conquer the ASL teaching structure. So you're learning a little bit here, but then vendors can come and meet with me and we'll have more in-depth study of that. And clients and service coordinators and other folks are going to get to meet with Michael, and we will give you more information on that as we know. So that is my insight for today. If there's any questions, I will check things out in the chat. But if not, please fill out the survey, because at the very bottom, there is a question for you about meeting for sign language in a private study group or a lab or office hours. I don't quite know what we're going to call it yet, but it's that concept, where we will meet once to twice a month just for extra study, fun, learning. You can pick my brain about stuff. Same thing with Michael. Okay? So I look forward to learning from all of you, and I look forward to your guys' insight. Thank you so much.
Sorry, real quickly, Melinda, I just have one more thing I wanted to ask you to share. You did have an opportunity to do a training for our management as well.
Yes.
So could you kind of share that too, the kind of that opportunity?
Sure. Michael and I, we got invited by our leadership management team to come on in and start talking with them about sign language and signing in the office. And we taught them the ABCs alphabet, and we taught them basic introductions. And already leadership had an assignment, and as they see me and as they see Michael, they've been introducing themselves. So I have met 5 people that are not managers of mine who I don't actually know at all. And it's been really cool because now I can remember their names. And just to give a little plug, I use sign language for supportive communication because I can hear, but I have a traumatic brain injury. So I use sign language to help me remember, because part of my memory cortex just isn't there from the accident I had like 14 years ago as a kid. So that's why I use it. And everyone now has a fingerspelled name, the people I've met, and I'm remembering them not only by face, but by name, which is really cool. And I challenge everyone as you learn introductions, as you learn greetings, as you learn the basics, to come meet Michael and I. Message us on Teams, send us a video, come find us in person, introduce yourself, and have those conversations. We really want to get to know you, and we want to have a fun time sharing this experience with you. And for leadership, they all know that we will pick on random people at our next meeting to introduce themselves to us so we can get to know them.
We certainly appreciate the receptiveness of our leadership team as it relates to this. Very important from our executive director. That's why she, spoke about it during our meeting beforehand. So again, I think Michael's takeaway when he shared with us was just try it, folks. Just try to communicate, sit down with us, and just take some time to try. And I appreciate that because I think that's what has been expressed is just that level of not wanting to mess up and not wanting to. And so I appreciate the approach that you all are taking to try to increase all of our communication at our regional center. So thank you guys.
Yeah, I really like it because now we don't have to scream across the office. As we learn more sign language, you can sign at, across the office and you don't have to yell for someone, which is really awesome. And you can have silent conversations, which are really cool too. So I look forward to seeing more of that. And I welcome anyone. Again, pick our brains, ask us questions. We are here. We love you and we want to support you.
Awesome. Thanks so much. And you can see in the chat that there's certainly folks that are interested as it relates to connecting and taking opportunities to have a longer session practicing these things in a kind of a comfortable environment. So thank you. All right. Rhonda, I saw you drop that thing in the chat there. If you would not mind sharing, we've got something going on here shortly. You're muted though.
Yeah,
There we go.
I was like, where's my button? I was just on Teams. I don't know why this messes me up every time when I switch platforms. I'm like, where are my controls? So let me find so I can share it real quick. Here we go. So this is, and I'll open it up for you guys, our project that we are working on with River City. Oh, I can't share my screen.
It's okay. I'll open up the document quick and we
Okay.
can just start talking about the project.
All right, so this is our project that we are working on for River City Apartments in Sacramento. And this is just kind of a little one-pager overview, talking about the location, some of the amenities, the set-aside units for Alta clients. And I think maybe you guys know, sometimes projects don't come to fruition and it requires a lot of advocacy and just so much follow through. So right now, this project is going to be going in front of the Sacramento Housing Authority Committee to seek approval for some funding. If that is approved, then it will go to the city council meeting for approval. And I have a little flyer with those meetings as well, if anyone is interested in attending and wants to give their support or a public comment.
Thank you. Yeah, we have again, state council is going to be supporting us. Peter Mendoza, I believe, is going to be coming out. Maybe Lisa will come out and we can have them provide some support for the meetings. But if you're in Sacramento City area, if you're interested in supporting more affordable housing for people with developmental disabilities, we would love to see if you're interested in joining us as well when it comes to this upcoming meeting. So Rhonda has all that information. Rhonda will put her information in the chat if she doesn't have her email in there, and she can make sure that if any of you want to be connected to participate in any of these public meetings, increasingly as we go to do more and more of these housing projects, we're going to be asking for support from the community for public hearings and things like that. And again, the voices of those impacted. I will not be living in this housing. My kids will not be living in this housing. But if there is a person with a developmental disability, a family member that really is interested in this that you guys are aware of, or you have service providers have a voice that you'd like to lend to us doing more and more affordable housing, we already kind of formalized this a little bit through our Disability Housing Alliance, which is the monthly meetings that we have, and it's across all of our catchment area, all 10 counties. And so again, Rhonda's the point of contact. If you'd like to be more involved in these things, just shoot her over an email. We can let you know about advocacy opportunities. There's opportunities all over the place. There's opportunities in Yolo County. There's going to be opportunities in Placer County. There's certainly opportunities in Sacramento County. So thank you, Rhonda. Rhonda does a lot of work on these things, and she's learning it at lightning speed, like we kind of all are, to try to ensure that we can get these housing projects done. With that being said, that project that we just showed you that pretty picture of is also was approved by our board of directors last night for the new contract. Additionally, I don't know if we have Dan on here too, because Dan works on these contracts, but nope, I see Dee Dee's here, which means Dan's not here because we have off Fridays, yes. But we also had a approval for the Mercy Housing Project, which is 10 units of housing located on right off of Stockton Boulevard. So if you're familiar with Stockton Boulevard, how it runs, and you're familiar with like 14th, Lemon Hill area, you know where Hiram Johnson West Campus, I guess they call it West Campus now only. West Campus is, it's like right between Stockton and West Campus. There's a strip of land right there. And we have 10 set aside units for housing that was approved, and that's with Mercy Housing. We've been supporting that project for 3 years, and we're still trying to see if we can maybe get a few more housing set asides. Rhonda and I are still looking at that over the next few months. Additionally, I think I said surprise to the board meeting last night, but we had a challenge with our project in Yolo County in the city of Woodland, which is the Woodland Phase 2 apartments, which is tough. Our regional center has really put a lot of importance in Yolo County and participating in the political process and trying to build the contacts out there. And it was all of the rains that occurred in Yolo County shut down the construction, which delayed them to be able to utilize the funding that we had set up. However, Rhonda was charged with, and myself, we to try to save as many housing units as we possibly can. And so, with the help of Yolo County Housing, we were able to get in contact with Danco, which is a developer that is also developing in Yolo County. And we were able to meet with them a couple times and meet with them with the Department of Developmental Services. And we were able to save for now, our housing projects in Yolo County. So instead of the development being in Woodland, this development that the board approved last night is in the city of West Sacramento. One thing that's nice about this is Danco is a new developer that has not worked with us before, that is very interested in doing other additional projects with us. But they also are going to be able to give us more units than what we had previously. So we had 18 units in the city of Woodland, and now we have 19 units that we're going to have as set asides in West Sacramento. We got a little bit better of a price. And so it gives us a net gain. It saves us from not losing out on all this housing that we were trying to do in Yolo County. And it's very important to us. So we were able to announce that to the board yesterday. They also approved that contract as well. So 3 contracts approved at the board. I know we're very, very pleased with that. And I will give a lot of respect. This would be impossible without Rhonda setting up all of these meetings, getting these contracts aligned, working with Dan to have the discussions with the developers. So it's an excellent opportunity for our regional center because we have the resources at our regional center where we can make this a priority. And so thank you, Rhonda. Some of you guys know that Rhonda's position is funded to kind of do something different. She runs our assistive technology pilot for the next 2 years with a number of service providers, looking at putting assistive technology into our affordable housing units, things like smart home technology, but she also has been really vital in our housing development efforts as well. So anyways, it's a great opportunity for our regional center to be able to leverage these types of positions to really benefit a huge swath of our clients. So let's see, Michelle, while we're on the good news phase, shall we talk about the DSP stipend? I feel like it's been 2 weeks since people have heard how good they've been doing.
Yeah, of course. I'm not able to share, but I have a lot of numbers to throw at you. So if you wanna, oh, you're muted, but I'm assume you're telling me you're making me co-host.
No, but I will share my screen though. Oh, unless you are able to.
Let me see. No, I'm not able to.
Okay, I'm going to share my screen then with the information right now. 1 second.
So I just, while John's pulling that up, I just wanted to share with everyone, I went back and looked at the calendar. We have 94 days. So 94 days left in this program. It ends at the end of June. So 94 more days to get the word out there and to get staff trained and to take part in this stipend. So it looks like we are statewide about a little over 53,000 of trainings have been completed. And then if we look down at our numbers, we went up 7.1%. So total for our regional center is 9,858 trainings. So we still are higher than any other regional center, about 800 trainings. So we continue to grow, and you guys do an excellent job at getting your staff out there, signed up and trained. We met with accounting this morning. There is another wave of payments coming out by the second week of April. And the amount of that bulk of payments is about $657,000. We will also be out at the job fair, I believe it's the DICE job fair out in Yuba, Sutter County on the 23rd. I have a couple of my team going out there. We're going to continue to share and give out flyers and update staff on this. And that's all.
Again, I am just blown away by the consistency of our service providers that are still promoting this to, like, we're still, I mean, even though we have so many that have been done and we have such a large share of the total amount, we still every week are really excelling as service providers and getting this out to our staff. So again, props to you guys for doing this. This is amazing. We've got 90 participants on right now, and we almost hit 10,000. I would not be surprised if we hit 10,000 when we do our next weekly update, which is where I was really hoping we could get when we had about 1,000 that were done, or 2,000. And so that being said, how many more days, Michelle?
94.
And about 30 days from now, she's planning on promoting this real hard, because you can get logged in and get it done in 2 days. I mean, this can be something that happens really quickly. So again, think about those staff that you may have that may be interested in participating in this, and please encourage them to do so. Carly, as I throw it over to you next, I'm gonna I guess I'm gonna bring up the DSP collaborative thing about the job fair first, since Michelle just kind of mentioned it, and then maybe we can go into the DDS and the coordinated career pathways and all your other travels and adventures.
Sounds good.
All right, so let me share my screen. All right, and we are seeing the DSP collaborative right there.
Yep.
And then right here at the top.
To the top, it'll take us to our next upcoming event, the Disability Industry Career Expo. We call it DICE. Our next event is on April 23rd from 10 a.m. to 2 p.m. out in Yuba City at the Sutter One Stop. They've been a great partner. We've been working with them to get this event going. This is for all of our providers who serve Yuba City, Marysville, any of those surrounding areas, to get some staff hired. We have, I think the last check was 16 or 17 vendors attending. We know this is going to be a smaller event just because we have less providers who serve that area. However, we have I didn't even check yesterday, but last time I checked, there were almost 50 job seekers signed up. But those are only the ones that are signed up. We're going to be having, I'm sure, a lot more attend. This is right next to the Sutter One Stop. This is one of their large event spaces, and they have several classes going at that time, and they're just going to be kind of shuffling those job seekers over as well. So if you're interested in attending, you can go where follow the where John showed you to go and sign up. You can either click the link or use the QR code to scan.
Thank you very much. I know Carly and I were maybe like a month or so ago, went up there and checked out the site and looked at also where the classrooms are right by, and looked at like our Yuba City office, which is across the parking lot from where this is located. And so it's just a fantastic venue for this. So really want to make sure you all take advantage of this free opportunity as service providers to be able to have a job fair just of your own, that we're not inviting any competitors that don't work with regional centers to be part of this job fair. So thank you so much, Carly, for all of your work and getting that going. And I know that Gary and others from the team have certainly and will be certainly helping out as they have been. I'm going to go over to DDS's website if that's okay now, Carly. And I want to see, they shuffled DDS's website around. So it's kind of hard to, it's not the same way as find things. So I'm going to share my screen. Maybe I'll just talk about that real quickly for those of you that, I don't know, love spending your time on DDS's website like I do. But on DDS's website, they've moved things all around now. And it's not, they don't have the rate reform stuff right at the front as previously, and the directives are not right there in the front anymore. So I'm not really accustomed to where everything is at yet, but I do know that if you search directives right away, it will bring up regional center directives. And the first thing that pops up for the regional center directives is the coordinated pathways. Are you guys seeing that screen?
Yes.
Yep. All right. And then Carly, I'm going to open this up, and then I'm wondering if you could share a little bit about what this is for folks. What are the coordinated career pathways?
So the coordinated career pathways, we've spoken a bit about it over the last few months. It's a new service that is being released to utilize primarily customized employment. This is going to be a service that is designed for, it is a time-limited service that is designed for anyone within 2 years of exiting high school or who are exiting sub-minimum wage work activity programs. This can be used for career exploration. And perfect, the whole list is right here for you to review. Career exploration, education, post internships, customized employment, anything that can help them really gain employment. Community awareness and engagement integration, that is also something that can be used.
Let me ask real quickly,
Yes.
and what was it about people that are exiting out of sub-minimum wage? What is about people that are, the focus is for that, or it's
So this is,
intended to support?
this is for a focus on either individuals who are exiting out of work activity programs, including sub-minimum wage programs, or who are within 2 years of graduating high school. So that's who this is
So
designed.
for that first group, real quickly,
Yeah.
for the first group of people, we don't have a huge number of those. We certainly have a ton of people that are within 2 years, I'm assuming, of graduating high school. But as far as those that are transitioning from the sub-minimum wage or out of the WAPs, do you see that this, like, is there a space for someone to develop something for those folks with this?
Yeah, absolutely. They, you know, what it means for transitioning out of work activity programs, I feel like they've left it kind of vague. If they left a work activity program and haven't gone to do anything, if they're still sitting at home, they may qualify if they haven't transitioned anything. We do have some trainings just for regional center staff so that we can get some more of these questions answered. That is on, I will be attending one on April 8th. So we can get some more of those questions answered and see kind of how specific those requirements are. But absolutely, I mean, we still have some clients in work activity programs, even if they are making minimum wage, who can definitely utilize this to transition into community employment. But this is also one of the big things that this was one of the big focuses of this is that this was the service code that could be utilized for customized employment, which we have not previously had a provider or had a service code for customized employment. And yes, Andrea, if you are interested, definitely reach out to me and I will put my email in the chat. They did also reach out to, or they also finally released the rates as well.
Hey guys, I'm gonna drop in the chat real quick for those of you that are on, because I don't know, maybe we can. Let's do this, Carly. Let's package this up to have Herman send out to everyone because our vendors already got it because that's the way things work. Some of you, it seems weird that we talk about these things at like Coffee with Community Services, but let me just historically explain a little bit about like this rollout of information. It used to be that we would have like things that would be implemented by the department, things that would come in via trailer bill, and there would be letters that were written to the regional center that talked about how we were going to be implementing these things. And we'd receive these letters typically in the fall after the budget came out. There's a lot of ongoing initiatives that happen now, and the department has really shifted to a directive way of communicating with us, which does not necessarily allow us to like spend time letting our managers know in advance about these things that are like new service codes that are coming out because our providers find out about it and literally are able to apply for standardization once these directives come out by and large. And so that's why we take time in this meeting where we at our regional center try not to get into too many things that are case management necessarily related as much because we do want to be able to provide training for our managers and then the service coordinators on those changes that are related to directives. But sometimes things like this, for those of you that are service providers, you may have been in the employment work group that's been talking about this for a year before, because it's been talked about for quite some time, Carly, right? The employment work group with, I believe DDS was the one that was really working a lot on defining kind of what this was going to look like. So just kind of wanted to share that a little bit because it is a little strange that, we are operationalizing on the move as it relates to some of these things, but that's just because that's the way the department gives out information now. All of our all the advocates, all the service providers, all the clients and families, everyone has access to this at the exact same time. And so that's why I think it's good when Carly says, hey, let's have this discussion in Coffee with Community Services so that we can let folks know about these new directives. So just wanted to share a little bit about that. And that's, again, a change to how things were, let's say, even just before COVID, where we didn't have directives that were consistently giving out, new direction for the regional centers. All right. In the chat, I just want to pop in there real quickly. So okay, so there's that information with the directives, and then there is, I'm going to just share real quick, because there's a number of different documents in there too. So it's not just the directive. They also put a service code description. They put in how to do the person-centered fact sheet. They did the referral evaluation form, fact sheet for providers, fact sheet for individuals and families, CCP program design guidance. So yeah, I think let's work with Herman, and this would be kind of a wide distribution thing for everyone. All right. And that one just came out. Let's see here. And I believe we have an update from Scott on HCBS. Oh, cool. I see Pride's going to reach out. And then I think In Alliances too for that, Carly. So right on.
All right.
Scott?
Well, for HCBS, I'm happy to report that we continue to strive towards our goal. We have through August of this year to get to all of our 522 programs. Currently, we've got 186 completed, and that has been reported to DDS. We're at 35.6% of goal. So the HCBS team continues to strive and do well, and hopefully next week we'll be able to introduce two of our newer members of the team as well.
Awesome. Yeah, again, I just noticed that little jump up in numbers. I see Marty's on my front page right now, but I saw the jump in numbers of you guys. So it's one of these times, Scott, I'm going to have you walk outside your door with your laptop so you can show what the outside of your door looks like. But Scott is now capturing all of the HCBS metrics in very large graphs outside his door that are taped up. And I appreciate that. I love being able to walk by and seeing that these staff are making like amazing, progress in getting this thing done. And we know that the state is looking very closely at the regional centers and the extent to which we're meeting our goals. And so I appreciate knowing that we're really on track for our regional center, and appreciate that we're bringing on 2 new staff as well that are going to be supporting even more of our QA activities there. On behalf of Joel, I was going to say on behalf of Jordan, but then I see Dee Dee right there. Hey, Dee Dee. So I'm told that I need to make an announcement from Jordan that we're going to be putting back out the RFPs for out-of-home respite agency and also for the outpatient substance use disorder treatment. Does that sound right?
Yes, they have just been sent out, the handout, and again, the orientation, if you want to watch it, is now live on our website under service providers. And these new proposal dates is due April 10th by 3 o'clock. So please, if you're interested, you know somebody that's interested, you have somebody that we could call for you that's interested, please let us know. Please ask us questions through the RFP website, but please go under service providers and get all the information, and let's find some great providers.
Again, we have 86 folks that are on here right now. Our hope is that someone may know someone that might be interested in doing an out-of-home respite center. That is something that has been a wish list for folks for quite some time at our regional center area. With the prices of commercial real estate right now, I'm hoping that a lease would not be cost prohibitive for folks that are looking at trying to do something like that. And we're really open to this existing anywhere. I know we talked about outlying areas giving a preference, but we have families that would really appreciate this type of support. And we've heard it for years. And so if we have anyone that is interested in doing that, please don't hesitate to reach out to the staff and get clarification if you have any questions. Outpatient substance use disorder treatment. Again, we were heavily involved in this world about 10 years ago with our regional center and working closely with Strategies for Change and with MAP at the time, the company that existed. But those vendorizations have not stayed with us, and we really do need some specialized support for people with developmental disabilities to get their substance use disorder treatment. And so if anyone knows anyone that's interested in this, we spent years researching this, and we have guidelines and supports for someone that wants to try to do it as a service provider. But we need someone that is willing to provide some specialized supports to folks with developmental disabilities in this world. So just want to put that out there, please. Be thinking about that for our population. And let me check the chat real quick and see if there's anything about that. Do they know if they have to set the limit? Oh, all right. Braden and Carly are getting that squared away. And let's see. Transportation. So we've got transportation service providers probably on here right now. Usually I got to go to my 3rd or 4th page to see if I've got some folks that don't have their cameras on. But we had the transportation work group meeting for the Department of Developmental Services a couple weeks ago. And Eric Champa had the ability to participate in that meeting as well. We also had the Desert Arc, which I believe is a service provider down in the San Diego Regional Center area for transportation as well. And then we had folks from Central Valley Regional Center, their Director of Client Services, and we had the CFO from Harbor Regional Center. I was wrong. It appears that the Department of Developmental Services is looking at changing the rate methodologies for transportation before the end of this fiscal year. In our discussions, it appears, and I shouldn't say changing, making available the option for a mileage rate. We know that the transportation rate study rates that were put forth were a per trip rate that was very concerning for a regional center like ours with a very large catchment area, where it's tough to incentivize people to go longer distances if they only get paid one amount for each trip. There is a mileage rate that the state has been working on for a very long time. And what we learned in the meeting is that they are going to look at trying to put that forth as an option for the rate study if the full implementation of the rate study does look like it's going to occur at the end of this fiscal year. Still no additional information as it relates to the rate study implementation, other than I can say that there is a very strong movement out there to support the full implementation of the rate study at the end of this fiscal year instead of delaying it, which is the current proposal from the governor's office. As for those of you that are transportation service providers and questions about what may or may not occur and what's going to be offered, it is likely that there will not be any guidance that we can provide to service providers. I'm just not guessing that we're going to have anything for at least another month or so. However, we will have our provider advisory committee meeting coming up, and that will be the second Thursday of April, which will be April 11th, and it's going to be at 9:30. And it is, and I can even, I think, drop the Zoom link into the copy hyperlink. I'll even drop that into the chat as well so that you have a Zoom link for the upcoming provider advisory committee meeting. But I was unable to attend the state Senate hearings that occurred. What was that, last week? I missed those hearings, and so I don't have all of the updates on that. Was there anyone that was at the hearings? I heard that there was quite a bit of participation by our service providers and good public comments. Is there anyone that wants to share any updates on the state Senate's budget subcommittee? Awesome. Well, then you guys are going to get an update at the provider advisory committee meeting. Jay, you guys were there, right? Was there quite a bit of folks that were there that were service providers?
Oh, sorry. I was on mute, wasn't I? Yeah, there were quite a few providers that were there. There was a lot of public commentary. There was actually quite a bit of folks that were there for public testimony. They actually kicked some of us out and said only self-advocates and families at one point. So we had quite a few people that talked. Jackie Foss, our founder, was on the committee as well. Seemed to have quite an impact, so we're very hopeful, but we haven't heard anything yet. We have 4 more people signed on to the letter from Assemblymember Nugent. I've said her name wrong. I keep saying it wrong.
Win.
Thank you.
It's all right.
So yeah, it was quite a few people out there. It was a really good event. So hopefully we can keep up the pressure.
Hey, since you're on and I see Carol is here as well, can I pick on you guys next to talk about what happened at our board meeting last night since no one knows about it? Carol, would you mind unmuting yourself as well since I know you were there too? So Jay, what did you guys do last night at our board meeting?
Well, we had decided at the beginning of actually the award that we gave an award to one of the SCs last night, a collaboration award. We decided at the end of last year that we really wanted to start identifying those people who worked really well in collaboration with our teams, and so we reached out to our directors, managers, supervisors, and our employers and asked, you know, who was it who wanted to be identified as somebody who really went out of their way to. Sorry, I'm getting a bunch of feedback. I don't know if that's me or not, but
you sound fine to us.
Okay.
You know what? I'm hearing the feedback as well. I think it's because Carol's unmuted as well.
So we literally brought together probably 20, 30 people and just discuss what is collaboration. It's not easy, and that's one of the things we talked about is it's not agreeing to things. It's actually working really hard to get to what we need to get to for that person. And so we celebrated Val Oldham last night, Valerie Oldham, and saying thank you. Again, it was our 2023 award, so we will have another one in 2024, but we were late getting behind it. It was really nice to have an opportunity to share that at the board meeting.
Awesome. Thank you very much, Carol. How did you guys get that all arranged?
Very carefully. I lied.
I will say the look on Valerie's face was amazing. I mean, it was absolutely amazing to see a longtime service coordinator like that getting the type of recognition for supporting, you know, those clients, and to have the client right there standing next to her talking about the impact was.
She has been in my unit for 17 years. She handles a caseload of deaf clients and a lot of clients with mental health, significant behavior challenges. Most of them are in the enhanced programs. So she accesses a lot of generic resources in the community, does a lot of those types of things. I got her there because she's also got several clients that are going into the technology program. So I told her that the board wanted us to be there with STEP because they wanted to discuss the technology program. So she wouldn't be surprised to see STEP there. So when we walked in, that's what she thought we were doing, is that we were there to, you know, listen to Jay blather on about the technology program. And at the beginning of his speech, Jay did an awesome job because it was so kind of generic in the beginning, and it almost sounded like he was talking about the technology program. So yeah, she did not know that she was getting the award.
Yeah,
And
again,
I just want to say, yeah, 10 years I worked with her, and she has been there to help advocate at hospitals. And I mean, she just really, really goes above and beyond. I cannot appreciate you guys enough for that. And Carol, for your leadership as well, like very much so.
Well, thank you guys. Again, I had heard what was going to go on, but I was not sure how it was going to work out. And that was a great opportunity. That's part of, I think Lori rolled it into her meeting our mission, part of her board reports, where she really wants to hear kind of from our community about how their interactions are with the regional center. So I want to share one more thing real quick, because I know we have Jay on here, and he was talking about Assemblywoman Wynn, and we talk about from time to time the Mirasol Village project, but it occurs to me that no one's ever seen what the inside of Mirasol Village looks like. And so this is this will be the demonstration unit for assistive technology for the Mirasol Village project. And this is one of the housing units. This is a beautiful one because it's a corner unit that has windows all around it. And you can see Assemblymember Wynn, who is out there, and Ruth from our Housing Access Services, and Jackie. And Jay, you guys were able to get a large group of clients together and be able to, share with the assembly member what supported living can be. And also, by having, I think, a number of our deaf clients there as well, how we can specialize those services for the deaf folks. And for me, I don't know, you didn't prompt Etta, but she did such an amazing job describing what her assistive technology is going to be inside of her apartment and how it's going to help her. And so, again, this is a great opportunity to see these affordable housing things turn into, opportunities to share with, statewide about housing development and the opportunities for things that are beyond the typical care home setting, opportunities for really independent living. There's a lot of other things that have gone on over the last few weeks that we're going to be going over in our newsletter, but I do want to jump over to our website, because there is a bunch of upcoming events related to Autism Awareness Month, or as we are saying, Autism Acceptance Month. And so that we actually have a newsletter article that's going to talk about that a little bit, about the terminology. So let me share my screen real quickly. Hopefully folks are familiar enough at this point with our events calendar. Please make sure that you are signed up on our website on the front page. Let me just repeat this one more time. Signing up on the front page of our website, down at the bottom down here. Please make sure that you are signed up so that when we share information, we are able to give it to all of you. All right, and if you go to our events calendar, you can see all of our upcoming events. I know we have this housing mixer that I'm hearing is going to be very popular here this afternoon. Rhonda, are you going to go over there? Yes, I see a thumbs up, right on. Very cool. So I've heard that the housing mixer has already been very popular. A lot of folks have been asking about this. Great way to learn about our housing access services. I got to get an update on how many we have that are utilizing that service now, but it is very well used and certainly very effective in getting a number of our clients housed. We have upcoming town hall meetings. We just did a town hall meeting actually 2 days ago in West Sacramento with Supervisor-elect Sheila Allen from Yolo County, as well as Oscar Villegas, who is the Yolo County Board of Supervisor that oversees West Sacramento. So we had an opportunity to do a town hall in West Sacramento, which is kind of part of our ongoing commitment to listening to the voices of the caregivers within Yolo County. And so we've got some upcoming dates in April and May as well for more community listening sessions. And it's a great opportunity as well for the county folks to learn more about the regional center and all the services that we have too. Let's see. And then again, if you go to our calendar down here, you can see all of the events that are set up. I believe that we're going to have a booth out at the Feet Walk and Carnival on April 13th. And so I know that Lori is going to be promoting this, that we get involved in a lot of these activities during the month of April. So wanted to throw that out there. During the month of March, there was multiple opportunities where we got Developmental Disability Awareness Month. We had proclamations that went on in Yolo County. I know there's one in Placer County, and then the big one down at the Capitol. We've got some awesome pictures of that, but they're going to be in our newsletter, and our newsletter is going to come out next week. So no one gets a preview until next week of what those pictures look like. But I will share that it is pretty neat that we were able to have that type of representation at the assembly, and also that the assembly gave the regional center a special resolution. And I would talk about the Cal AHA Summit, but since we're out of time, I'm going to share instead, and I'll talk more about it next week. Maybe we'll talk more about some of our housing stuff. But I do want to share this event. This is an event on Friday, April 5th. I believe that Herman has also put this out on our system as well, but this is going out via, let's see. This is going out via, it went out via our MailChimp server, and I'll drop it in our chat right now if you're interested in participating in this event that is getting put on. And I will say I have had in the chat, ooh, this will be interesting to see if that actually works, that big hyperlink that I just put in there. I've had questions in the chat, at least private questions that have been sent to me in the chat that said, hey, John, we saw you on the news for Pride Industries for the hearing that went on at the Board of Supervisors. And certainly Jeff was on there, Jeff Dern, and a number of participants from Pride Industries. Pride Industries went in front of the Board of Supervisors a couple of days ago to challenge the determination, basically by the Board of by the RFP process for the new contractor out at the airport. And so the Board of Supervisors decided to award the contract to an out-of-state for-profit business that does not necessarily specialize in providing any supports to people with developmental disabilities. Certainly a big concern of the regional center, but I will say I had an opportunity to speak to Jeff Dern, their executive director, spoke to Derlin, spoke to Dawn, spoke with the airport director, spoke with the county executive, spoke with the deputy county executive, and spoke with the new company, TWW, that is going to be taking over that contract. We have 36 clients that are there, and we're going to do everything that we can do at the regional center to support individuals to be able to maintain their employment there and to support Pride as much as possible in their efforts to remain involved with their interest in supporting individuals at all kinds of different settings, including the airport. And so those are some of the things that we at the regional center, Carly and I have been having discussions about kind of next steps on how we can support these things. But we have, I believe, until June, which is when the contract looks like it will be switching over. And so that means we really have about 1 month to get things figured out as far as what supports might look like and things like that. So as I said to one planning team that I spoke to about this, that was very concerned, we know what our timeframes are, and we'll be working collaboratively with Pride and with the new company that's going to be taking over the contract to ensure that our 36 individuals that are out there working are still able to maintain their employment in the manner that they wish, because that's what's most important. So let's see. I think that takes us well past our time, and we will look forward to maybe hitting some of these other agenda items next week. And I will just say, for my purposes, being out there with Pride too at the public hearing, I really appreciate all the Pride staff that came out, all the people that supported that came out, and those that were impacted, because those were really the strongest voices in the room, are the actual individuals themselves that work out there at the airport and talked about their experiences. So anyways, all right. Thank you, folks. Hope everyone has a great, this is Cesar Chavez Day weekend for those of you that work at the regional center. If those of you that are in residential, you're working all weekend long if you're a residential provider. So you don't have time off. But we have a 3-day weekend at the regional center, and we will be back on Tuesday and back at Coffee with Community Services next week. Hope everyone has a good one. Take care, folks.